Welcome to the Chicken Wing Dissection Lab. In this lab, we will examine how muscles move bones and how the chicken wing is similar to a human arm. Of course, there are many differences to the human arm and a chicken wing. We cannot fly, for one thing, but we'll see that there are a lot of analogous structures. If we were to think of this chicken wing as a human arm, we could imagine how at the upper wing it connects to a shoulder. Then you have an upper arm portion that terminates at an elbow area. Then you have a lower wing similar to our forearm that goes to a kind of wrist joint, and then a wing tip that would be similar to our hand. This wing is already dissected, meaning it has the skin taken off, and most of the underlying tissue has been taken away so that we can pretty clearly see the muscles and other connective tissue that we're interested in. We can see the bones. So we have one bone running from the end of the upper wing to the end of the lower wing. Then we have a bone running through the lower wing to the wing tip. We can see that there are many muscles, and some form bundles, but there are many muscles in the upper and lower wings. The muscles of the upper wing tend to be a little bit thicker, though the muscles of the lower wing are quite numerous. The quantity of muscles in the lower wing allows for greater rotation of the wing, which would be really important to a chicken trying to fly, to be able to move that wing in more directions. In a moment, we'll see how those muscles provide that movement. We can see the joints. At the ends of the muscle, we can see where the connective tissue creates a tendon attaching the muscle to the bone. We can also see places where connective tissue connects a bone to another bone, which is a ligament. So under here we can see a ligament connecting the lower wing bone to the upper wing bone, creating a strong joint. Muscles at joints can be categorized as flexors or extensors. Muscles that are flexors, if we concentrate on this joint right here, a flexor muscle is going to reduce the angle of the joint. Right now, this joint has a very large angle. If I flex the joint, the angle gets smaller. If I extend the joint, the angle gets larger. The way this works is that when a muscle contracts, it gets shorter. And when it gets shorter, where the muscle attaches to the bone is going to pull on the adjacent bone. We can actually demonstrate this with the chicken wing. If I pull on the muscle, the flexor muscle, we can see the wing flex and the angle gets smaller. If I then pull on the extensor muscle, it goes back the other direction, increasing the angle of the joint. Again, I flex, similar to our bicep muscle in our upper arm, and then similar to the tricep muscle in our lower arm, when I contract this muscle, the joint will extend.